Guys, let me tell you this. If I hadn't heard this story myself, I would never have believed it if someone else had told it to me. So there I was in the waiting room for my routine dental cleaning last Thursday, flipping through a 3-year-old magazine about gardening, when I heard raised voices coming from the conference room down the hall. The receptionist looked mortified and quickly turned up the elevator music, but curiosity got the better of me. Later that day, I ran to Dr. Sanders from the dental board at the coffee shop next door. He looked like he'd aged 10 years in one afternoon. I asked if everything was all right, and he just shook his head and muttered 2 words, Dr. Patel. I knew Dr. Patel, brilliant dentist, very thorough, maybe a little too enthusiastic about oral hygiene. Dr. Sanders told me they'd called him in for an emergency review because Dr. Patel had extracted 340 teeth yesterday. From just 12 patients, 340 teeth. I did the math in my head. And that's like almost every tooth those people had. That's wildly unbelievable. Dr. Sanders said the board asked Patel to explain Payne's valve, and apparently Patel was quite proud of his work. He explained that one patient had a cavity, and cavities spread, correct? So logically, he extracted the tooth next to it as a precaution. But then he started thinking, what if the infection had already jumped to the other neighboring teeth? Better be safe than sorry. Patel described it like he was narrating a documentary. He said before he knew it, he was doing full-mouth extractions on everyone. When the board sat there in stunned silence, Patel smiled and said, "Preventive care." So, this is how Dr. Patel became the first dentist in state history to be investigated for being too thorough.